Staphylococcus. So what are the Staphylococcus? They are the gram-positive, catalase positive bacteria. How we differentiate between the three species which are most commonly well known in of the Staphylococcus? We will look for the Coagulase positivity. If the coccus is positive, Coagulase positive, we will label it as the Staphylococcus aureus. But if it's negative, then we will look for other two species, Epidermatitis or Saprophyticus. How how we would further differentiate between the Staphylococcus epidermidis and the Saprophyticus on the basis of the novobiocin sensitivity. Staphylococcus epidermidis is novobiocin sensitive, but Saprophyticus is resistant. So this in general give us the idea that what they are talking about. So let us talk about the Staphylococcus aureus. Staphylococcus aureus is normal flora of our body. It's found in the nares, skins, genital area, axilla, ears, groin area. So how this bacteria affect the body? When there is breakage in the skin, only then they cause the effect skin infection. Otherwise these are the normal flora. So there are the common skin diseases caused by the Staphylococcus aureus is the cellulitis. Now the cellulitis is happened due to two organisms. One is Staphylococcus aureus and other one is the Staphylococcus pyogenes. So how we will differentiate in between these two? Staphylococcus aureus cause the purulent cellulitis, while the pyogenes it forms the non-purulent cellulitis. So this is very important to remember. And Staphylococcus aureus is known to be causing the abscesses, especially the liver abscess, and it causes pneumonia. They do not cause the pneumonia directly. If there is pre-existing viral infection, only then Staphylococcus is the most common cause of the pneumonia, which we call as the secondary pneumonia. Staphylococcus aureus is the common cause of the infective endocarditis in IV drug abusers. It is also common cause of the septic arthritis and the osteomyelitis. So what is the virulence factor of Streptococcus aureus? It is the protein A. What this protein A does, it binds the FcIgG, the region of IgG FC, because we know the antibody contain two binding sites. One is FAB and other one is FC. So FAB is the antibody binding site and FC is the constant site. So this bind with the FC region of the IgG and inhibit the complement activation and the phagocytosis. So they basically protect from the mechanism of the body to be attacked by. Okay, so what happened? The next thing, these are found in the milk products and mayonnaise based salads. So a person who eats the preformed toxins of the Staphylococcus aureus, which are found in the mayonnaise based salads and milk products, those which are like cooked for quite a long time. So what happened? This food poisoning occur very fast, within 2 to 6 hours, and it causes the predominant vomiting, because we have to distinguish between Streptococcus aureus food poisoning from the Bacillus cereus food poisoning. It is also a cause of the watery, non-bloody diarrhea, but the predominance of the vomiting is present in the Staphylococcus. So immediately after eating the food, there is predominant vomiting followed by the diarrhea. Is the classic case for the Staph aureus called diarrhea. So there are few other things which we must know about the Staphylococcus aureus. Another thing is the super antigen of the Staphylococcus aureus, which is the TSST1 super antigen. What this causes the toxic shock syndrome. In which patients this will cause the toxic shock syndrome? The patient who are using the tampon or undergone the recent surgery or the skin or skin lesion or the burns or sinusitis or nasal surgery. In all these patients, the most common cause of the toxic shock syndrome is the Staphylococcus aureus. Other than this, there are other pathogens causing this toxic shock syndrome. Is same the group A Streptococcus pyogenes and some others exotoxins from any bacteria, but those are less likely to cause. So the features of the toxic shock syndrome will be a patient will be presented with a fever, hypotension. There would be the diffuse macular rash, destigmatization, which will like occur 1 to 3 weeks after the disease. The patient will be in the alter mental status, but there will be no focal neurological deficit, because if there will be focal neurological deficit, then our diagnosis will be changed. So treatment is simply we will go for the supportive management and just remove the foreign body like tampon is fast is and we will give them the antibiotics, that's all. So there are some other things to mention about the Staphylococcus aureus. This Staphylococcus aureus is very likely to cause the antibody resistance. What happened? This Staphylococcus aureus, there are strains of some Staphylococcus aureus which occur in the hospitalized seriously ill patient. What happened? They generate the resistance against the penicillins, because the drug of choice for sensitive Staphylococcus aureus are the penicillin, especially the methicillin and amoxicillin. So what happened? There is some strains of the Staphylococcus aureus which contain the MEC-A gene. What it do? It produce the penicillin binding protein 2A. It varies it forms the penicillin binding protein, but those are altered. So 2A is these are the altered structure of the penicillin binding protein, because for the acting of the penicillins we require the protein binding proteins. So due to alteration of this protein, these penicillin cannot act on the Streptococcus aureus. So the strain is called as the MRSA. So this MRSA and resistance is very important to remember. For treatment of the MRSA, we will go towards beta-lactam drugs, which do not like act by this acting on the beta-lactam ring of this bacteria's cell wall. So we will simply go for towards the trimethoprim, sulfoxafenone, or we will see for the clindamycin or doxycycline. But in your exam, the best choice will be the vancomycin. So we must have to remember the mechanism of action of these drugs too. So trimethoprim and the sulfamethoxazole are the folate synthesis inhibitors, and clindamycin it simply act by the binding with the 50S ribosomal unit, doxy it by the 30 S subunit of the ribosome, and vanco it directly integrate into the peptidoglycan subunits. So this is very important to remember. There are few things to be remembered about the Staphylococcus aureus, but they are less likely. Like they'll give simply you in the same. One is the Staphylococcus aureus is it also contain an enzyme called as the hyaluronidase, which is also present in the Streptococcus pyogenes and the Clostridium perfringens. So what they do, they simply, damage the ground substance and spread the staphylococcus spread through this enzyme, because we know it causes the abscesses, and it is the most common cause of the meningitis in the patients coming to you in the trauma. So when the trauma occurred, so it's simply due to this hyaluronase enzyme, they digest the extracellular substance and hematogeneously go towards the site and cause the abscess, like abscess in the liver, and meningitis if it's the brain. So we must have to remember also this, and they also contain and they also produce alpha hemolysin, which destroy the cell membranes of the WBCs and the RBCs. And it is also the most common, this is very important point to remember, is the most common cause of the mastitis in child in the sorry lactating women, a woman who is lactating and she is having mastitis. How we would define the mastitis? It would be the pain along with the swelling and the erythema. So we will say that due to lactation there must be, like due to sucking of the by sucking of the nipples by the baby, there must be the cracks. So through those cracks, this Staphylococcus aureus from the mouth of the baby must have transmitted into the breast and caused this mastitis. So these are the almost most of the stuff which are important for the Staphylococcus aureus. So for other content like this, stay tuned. Thank you.